Hey there, this is Dr. Roger Moczygemba at Direct Med Clinic. So if you're looking at this video, it's probably because you just became a member or you're thinking about becoming a member of Direct Med Clinic. So I wanted to give you a little bit of information about how it works. First of all, before I do that, let me say thank you so much for looking into what we do and how we provide care. I get excited to know that we can provide care which is direct, accessible, and affordable. All right, so one of the first things that will happen is we'll give you access to us with a HIPAA-compliant secure app, a tool that we can use to provide care, because we can do it directly and use whatever tools work for us. So through the app, you'll be able to send us text messages, and in those messages they can be for administrative things like setting up an appointment or needing a refill, something like that. You can also send us text messages with clinical information like how you're feeling, like you might think you might have a cold or allergies, or you can text us what your blood pressure is if we're trying to get a new blood pressure medicine for you, or we can follow up with your blood sugar with these text messages. So another way to use the app very conveniently is if, for example, after hours and you're at the lake or something and you step on something sharp and get a cut, you can send us a picture of that and ask us if that needs stitches or if you can just clean it up and treat it with some butterfly band-aids. Another thing you can do is you can upload a picture of a rash, and we can start looking at it that way to see if we can treat it without you having to come in. Or so there's the app is really useful to communicate with us. One of the first things that we'll want to do when you become a member is to have you come in for a biometric screening or a physical. We want to learn your health history, learn if you have any chronic conditions, so we can get a handle on that and how to best treat them. Frequently, we'll want to do a blood draw at that time to see where your blood work is at. So how does labs work with our clinic? Direct Med Clinic contracts with LabCorp, and we get special pricing with that, and we pass those savings on to the members. An example of this great savings would be something like a lipid panel, which is the blood test for checking cholesterol. That costs us about $2.50. If you get that test done through your insurance, it'd probably be around $100 or so. So that's an example of some great savings. We have the same setup when it comes to imaging. We have a cash rate set up with imaging facilities around town that gives you also the same kind of discount. An example of that might be an MRI might be a couple $1,000 if you go through your insurance. If you get the MRI through us, that MRI would probably be less than $600. So then let's see, let's talk about what happens if you get sick. First of all, let's talk about respiratory illness, because in the days of COVID, everybody's concerned about COVID if they have any respiratory symptoms, and as well they should be. So with that, you'll let us know and we'll set up a virtual visit with you. And then if it's something like allergies, we'll just go ahead and treat that way. If it's something like COVID, we'll prescribe early treatment. If we feel like you need a COVID test, we'll have you come and drive by and do a rapid COVID test. We have that in the clinic. And by the way, early treatment of COVID is a thing, and we follow the protocols for early treatment to try to keep people out of the hospital. We want to get ahead of COVID early and keep it from getting any worse. Okay, so then when you come in for an office visit, it only costs you $10 with a membership, and included in that are everything obviously that we do as a family practice clinic, like chronic condition management like diabetes, hypertension, cholesterol, thyroid. But in addition to that, we have in the clinic whatever you might find in an urgent care, like IV fluids, breathing treatments. We have the ability to do sutures or stitches. We can give antibiotic shots or pain shots, and all of that is included in the $10 fee. In other words, there's no extra fee for anything else that we do in the clinic. Okay, so then I've already talked about the chronic disease management. Now, if we get to a point where we feel like we might need a specialist, we subscribe to an e-consult service where we as providers can reach out to these specialists and basically present your case to them and have a consult with them. And a lot of times they'll come back with recommendations for us to follow. So this is another way that we keep healthcare affordable for you. So we've had a consult with a specialist, and we're passing on that information through us to take your care to the next level. Now, let's say that they come back and they say that in this case you would need a hands-on visit with a specialist. We have contacts with specialists that also honor cash pricing if you don't have any kind of secondary insurance or backup insurance to your plan with Direct Medical Clinic. So we can make that referral as appropriate for you. And a similar thing works with the hospital. If you do need to be admitted to the hospital, we'll work with the hospitalists that we know and the hospitals that we know to provide the best, most affordable care for you. And when it comes to prescriptions, we will try to find the most affordable prescriptions for you. There's other services that we can use to help get the prescriptions affordable. So I hope that makes sense, what I've talked about, and I hope that you can see how direct care is a wonderful thing. It gives you this affordable access. I get really excited about being able to restore the good old-fashioned doctor-patient relationship where folks had access to a doctor, and this is affordable as well. Okay, so if you have more questions, you might be able to find some more information on our website. We've got a lot of information on there. I'll leave the contact information for our doctor program liaison with this video, and I would also encourage you to look at some of the testimonials of patients that have been using Direct Med Clinic. So this is Dr. Roger signing off at Direct Med Clinic. We hope to hear from you.